People often ask a great question, which is a simple question. And that question is, what is osteopathy? And it's such a vast topic that it really stays outside of the realm of a quote elevator pitch. People want to know, what's the 30-second version? Well, the 30-second version is, it's an American form of natural healing developed in the Civil War era that is a manual therapy that involves hands on the body based on anatomy to treat injuries and restrictions in the body. That's all true. But there are some features of osteopathy that are unique to it. And one of those features is that we spend hours and days and weeks and months and years in a lifetime learning how to palpate all the different levels of physiology in a body. So we don't just look at joints or fascia or the lymph or organs or bones or the head or the feet or the spine or the fluid systems. We look at all of it. And our training involves learning how to distinguish those different tissue levels so that when a patient comes in who has had an injury or some kind of trauma or wear and tear or whatever they may be suffering from, we can put our hands on and we have the full scope of physiology there to perceive. So this is often why people come to us as osteopaths after having gone to many, many practitioners and doctors and healers or whomever. So an osteopath can bring that to the table, bring that full range of perception to the table. It's very unique. And the other thing that was really brought to light through these osteopaths in the past was a concept of an involuntary mechanism. So the mechanism is a term that we use in osteopathy to describe the living or organizational forces that are occurring within a body involuntarily. This means the person doesn't know about it. This means the person can't necessarily control it. It's the kind of living intelligence, if you will. It's a principle of organization and function that's occurring, and it's not theoretical. It's something that can be directly palpated with the hands, even by novice students. So this is the world that has been fleshed out over the years in the study of osteopathy. It's a whole world that most people walking around don't even know about. We could call it the subtle body, which is a nice name for it. So one can put their hands on a patient and this whole world emerges of tissue moving around and fluids moving around, but not just randomly. as if they all have a purpose and an objective and an intelligence. So we call this the involuntary mechanism. And one of the features of the involuntary mechanism is that it is interactive. So the feature is one of interactivity. This means that the whole involuntary mechanism of the patient responds to the contact of the osteopath. It responds to the concentration of the osteopath. It responds to the awareness of the osteopath. It's a new concept, no doubt, for many people, but this is something that has been corroborated many, many times over the years. And it's obvious to anybody who practices and studies osteopathy. And that involuntary mechanism does work if it's contacted in the proper way and with the proper type of attention. It does healing work within that patient's body on a level that can't be approached just mechanically by putting force through the hands on the body. In other words, the forces that are doing the healing work in the patient's body come from this involuntary mechanism. This is a radical concept for somebody who's never experienced it or thought about it. But it's one of the main features of osteopathic treatment, especially what we would call osteopathy in the cranial field. And interacting with that involuntary mechanism is what allows the patient to get such impressive results. So these are two features of osteopathy that really are unique to osteopathy. And we can't really talk about, quote, what is osteopathy without delving into those concepts.